Next, we are inviting Dr. Zeinab Hijazi, who is the Global Mental Health Lead at UNICEF headquarters and who lives here in New York. She guides policy research, advocacy, and innovation initiatives across 7 regions to strengthen mental health and psychosocial support for children and families in both humanitarian and development contexts. Zeinab is a clinical psychologist by profession and promoting integrated programs across health, education, protection sectors, and beyond, with over 18 years of experience to draw from, including previous experience working in the Middle East and North Africa and various global MHPSS initiatives. Please go ahead.
Thank you so much, Marie. Well, this is embarrassing. I'm wearing the same exact shirt. Headshot. I thought it was on design. No, it was not. Lesson learned. Okay. I'm not wearing this during effect. So thank you so much, Marie. Thank you for inviting me to this launch of the compendium. I'm really excited, honestly, to be part of this because the compendium really brings together evidence, it brings together lived experience, it brings together the voices of children and young people and caregivers and practitioners. And it reminds us that health is never lived in silos. And it reminds us that behind every life and behind every number, there is a family and there is a story. This week, there is going to be a lot of attention on the high-level meeting on NCDs and mental health. There are going to be political declarations that are adopted, where there are targets reaffirmed, commitments that are announced, and of course that work really matters. But what makes today's event unique, and this event in particular, is that it roots the discussion in reality. It also shows us the intersection between NCDs and mental health, what it looks like in the lives of children. And, as Gregory mentioned, NCDs and mental health are closely interlinked, and they're really, truly inseparable, despite, of course, knowing very well that mental health is an issue in its own right. For families, that means illness is rarely experienced in one dimension alone. It also means that, it is lived really at the meeting point of the body, the mind, and the environment. And the compendium makes that visible. It shows that when a child is living with asthma, with diabetes, or epilepsy, the challenge doesn't end with treatment. It is carried into the classroom, into friendships, and into the home. Without support, it can erode confidence, disrupt learning, and strain relationships. And for parents or caregivers who are also living with NCDs, the challenge is not only the management of their own condition, right? It's also the impact on their children and their security and their safety. At the same time, mental health conditions often emerge early in life, affecting development, education, and safety. Left unaddressed, the impact spreads across families and communities and even across economies. What we see in the compendium and in our daily work is that the boundaries between NCDs and mental health are not drawn in children's lives. They are drawn in the way that our systems are built, right? It's the way that we are responding to these issues. And those issues and those systems can be changed, right? So from UNICEF's work across countries, I know and I've seen and I've witnessed this change being, already implemented by our colleagues and our staff on the ground. And some examples I'd like to share with you. In Belize, mothers in rural communities, they once had very little access to mental health support during pregnancy and postpartum. Today we have perinatal mental health, and it is part of our routine primary health care. Healthcare workers are trained to screen mothers, not only for depression and anxiety, but also for hypertension and also for diabetes during pregnancy. This care that is now offered in a way that happens in one place at one time, this is what we need to be aspiring towards. A mother is no longer left to manage her health in fragments. She is supported as a whole person, as she should be. In Nepal, nearly 90,000 children, adolescents, and caregivers have been reached through school-based and community-based psychosocial programs. These efforts are connected to broader adolescent health services. So a young person who learns coping mechanisms in a classroom may also be referred to health services for nutrition, for even support to prevent tobacco use or substance use, as we are seeing these issues rise in education settings. So the link between psychosocial support and NCD risk reduction is also very clear in early childhood and adolescence. In Lebanon, we also have a beautiful Play and Heal initiative, which really offers children in crisis settings to express themselves and recover a sense of safety. These approaches are locally designed and they're play-based, but they're also grounded in evidence. And they are used in communities where children face displacement, but they're also established in communities where we also have high rates of chronic respiratory conditions, of malnutrition, and other NCDs. And so supporting mental health in these types of contexts needs to ensure the link to NCD services. So these are not isolated stories, they are part of a broader shift. A shift where health, education, and social protection systems are working together in ways that feel coherent to families. A shift where frontline workers are equipped not just to treat a condition, but to support a person and the community around it. At the system level, UNICEF and WHO also have a joint program on child and adolescent mental health, and we are working to help governments make this shift at scale. Since 2022, we've supported 13 countries to design services that integrate mental health into schools, clinics, and community platforms. And earlier this year, we launched new guidance to give policymakers and practitioners concrete steps for building these types of integrated services. So it's not a theory, it's a practical action that can be taken now. So what unites all these efforts is this recognition that we must begin early and that we must be reaching children and young people across sectors to really realize this intersection between mental health and NCDs. So when a mother receives support at a prenatal clinic, when a teacher is equipped to nurture children's emotional skills, when an adolescent can access psychosocial health services in the same community, those are profound impacts that we all need to be striving for. So as we look ahead to the political declaration later this week, there are reasons for encouragement. The draft is now, almost there. We're hoping that it will pass without resistance. But we also know that, as Gregory mentioned, we really worked hard to ensure children and adolescents are at the heart of that declaration. And I'm really proud to say that in this draft, we actually have 25 mentions of children and young people in the declaration, compared to 2018, where we only had 5 mentions. That's a very, very huge accomplishment. And so it really is an important step in the right direction. But of course, I think Dan mentioned this is only going to matter if this translates into services that children can access. So, really I want to close, friends, colleagues, I think the compendium is named Bridging the Divide. And the divide is real, I think, in the way that our systems have been organized. But the bridges are already, being built by health workers, by teachers, by community workers, by children and young people themselves. And I'm really excited for our later panel where we will hear directly from young people. Our responsibility really is to walk across those bridges together and to ensure that commitments that we make this week do not remain distant promises. And to ensure that a generation that is growing up with NCDs and mental health challenges can also grow up with care, dignity, and hope. Thank you so much.
Thank you so much, Zeinab, for words very well spoken. And as Zeinab just